Hello, good afternoon, and welcome again to this channel. Today, we'll be looking at challenges of the healthcare system. Have you ever been sick and visited an hospital and you are just irritated by how you were treated in the hospital, or you were just discouraged to go back to visit the hospital? Again, today, we'll be looking at these challenges facing the Nigeria healthcare system and how these challenges could be resolved. The Nigeria healthcare system faces several and multiple challenges that affect the effective delivery of their services, whether it be doctor-patient relations, whether it be nurse-doctor relation, whatever kind of service that they render in the hospital or in any healthcare system. There are several challenges facing them. These challenges affect both access, the quality, and the affordability of healthcare in Nigeria. Let's look at the 5 major challenges and their impacts. The first and the foremost of this problem is the issue of funding. In every healthcare delivery system in Nigeria, we have the issue of inadequate funding. Nigeria today allocates 4 to 6% of its annual budget to healthcare. And in the Abuja Declaration, we have 15% as the target. And we know that when there is no money, when there is limited funds, we would have poor infrastructure. The buildings can never be standard as they ought to be. We have issues of people sleeping on the floor because we don't have enough beds in our hospitals. We have people who have to go and get medications for themselves. And even most of the equipment that they use in hospitals today are outdated. Why? Because there is no fund for this equipment to be replaced. We also have shortage of essential medicine, which would lead to people to buying medications for themselves. And by implication, people buy fake medications, fake injectables, and the likes. Also, we also have the problem, inadequate funding also leads to the problem of underpaid healthcare workers. Our nurses and doctors are underpaid, our pharmacists, our physiotherapists, and every other health workers are underpaid. And the impact of this is that when there is inadequate funding, it will lead to many hospitals lacking the resources that they need, forcing patients to seek expensive medical health care. The second problem is brain drain. What do we mean by brain drain? In Nigeria today, you would see that most of our doctors and nurses who have graduated medical school move out of the country to seek for greener pastures. Thousands of our doctors and nurses migrate to the Western countries like the UK, Canada, Australia yearly because they don't have, the Nigerian healthcare would not pay them well. There's poor working condition. There's lack of career and career growth and opportunities for them. Also, there is lack of job security and economic stability. So they move to these countries to seek greener pastures, hereby leaving the healthcare system with shortage of skilled professionals, leading to long wait time and low quality in healthcare. That is why sometimes you go to general hospital, you have to wait for 4, 5, 6 hours before you are being attended to by a doctor. We also have another major problem is poor healthcare infrastructure. Many hospitals, because they don't have enough money, will have lack of electricity. We've heard cases of people undergoing surgery and the lights just went out. That is a major problem. There's we don't have good water supply. Also, basic medical supplies are missing in our healthcare structures, especially in our public healthcare system. People who suffer mostly are those in the rural area. They suffer from inadequate healthcare facilities. Also, the maintenance culture, if you would agree with me, in Nigeria has worsened, and by leaving our healthcare system in a deplorable state. The impact of this is that there will be overcrowding in urban hospitals. If the rural hospital have inadequate healthcare facilities, what we refer to as the primary healthcare centers don't have the equipment or the facilities to aid or care for people who are sick, they would have to move to urban hospital, thereby causing overcrowding. Also, there will be increase in mortality rates due to lack of untimely medical interventions. Also, corruption and mismanagement. Corruption is a big issue in Nigeria that needs to be treated at the very roots. Funds meant for healthcare development are usually misappropriated or diverted to do something else. And we have issues like ghost workers, non-existent employees on payrolls. And this is one thing that the government have been trying to combat for so many years, but to no avail. We also have issues of fraud in medical supply procurement, diversion of public hospital drugs to private pharmacies. We have some medical practitioners who own pharmacies or clinic. They divert supplies that come from the government to their own private practices. This will lead to healthcare facilities remaining underdeveloped despite the little budget that is being allocated to them. Now, another challenge is high disease burden. Nigeria faces malaria, HIV, tuberculosis, and non-communicable diseases like hypertension and diabetes in high number. The number are so high, and we have little or non-existent facility to cater for these people. We also have the issue of poor sanitation and weak public health policies, which will worsen the spread of disease. Now, this problem will lead to high mortality rates, low life expectancy, and economy loss. In conclusion, to address these issues, we need to address the following things. Number one, increase funding and let there be proper allocation. The allocation, which is about 4 to 6%, has to move higher to about 15% of the budget. Then we need better incentives to retain our healthcare professionals to avoid brain drain in the health care system. Also, we need to improve infrastructure and invest in medical technology. Also, we need a strict rule for anti-corruption measures in healthcare spending. When any healthcare professional is found guilty of this, they need to be prosecuted on time. We also need a strong public health policy to reduce the disease burden. Thank you. Don't forget to like and to subscribe. See you in the next video.